Hello, madam.
Yes po, Doc. Pero sorry, na-click ko ang leave. Sorry lang po. Hello po, classmates. Good evening, Dr. Hector. The yin of the body is rooted in the kidneys. All the organs and tissues are nourished by this constructive energy. A general deficiency of yin will eventually lead to malnourishment of the lungs, liver, heart, stomach, and to a lesser extent the spleen. Depending on the patient's constitution, kidney yin deficiency may lead, for example, to lung or heart yin deficiency.
Okay, we'd like to welcome Sir Dino Pinheiro of Legazpi City. Paki-unmute po, Sir Dino.
Okay, we continue with the discussion. The yin of the body is rooted in the kidneys. All the organs and tissues are nourished by this constructive energy. A general deficiency of yin will eventually lead to malnourishment of the lungs, liver, heart, stomach, and to a lesser extent, the spleen. Depending on the patient's constitution, kidney yin deficiency may lead, for example, to lung or heart yin deficiency. However, a single yin organ can suffer from yin deficiency without participation or involvement of kidney yin. For example, an isolated yin deficiency of the stomach does not necessarily mean that the yin of the kidneys is automatically affected. However, over the long term, deficiency of stomach yin will lead to kidney yin deficiency. Next, we discuss about the red, dry, and crack in the center of the tongue. The stomach plays a very important role in the production of energy and fluids. It is the only hollow organ that can present with a pattern of true yin deficiency. It has a close connection to the 5 yin organs. In the Chinese medical classics, the stomach is described as the sea of fluids and grains. Solids and liquids are received, rotted, and ripened by the stomach. In order to properly function, the stomach needs a damp environment, hence the saying, the stomach loves dampness and dislikes dryness. The stomach condenses the impure part of the essence in food, which then forms part of the body fluids. The tongue coating reflects the quality of the stomach chi and of damp environment in the stomach. A thin, white, and moist coating is a sign of the harmonious working of healthy stomach chi. When taken in excess, fried or toasted foods, hot spices like curry, chili, pepper, mustard, or hot drinks like coffee have a drying effect on the fluids in the stomach. In the beginning, the center of the tongue becomes dry. After a while, the continuous intake of such foods will injure the stomach yin. This development is reflected in different signs in the tongue. First, a dry tongue center is visible, which is a sign of slight deficiency of fluids. If this area becomes redder, it reflects the development of stomach heat. The typical feeling of hunger that accompanies this pathology is described as follows in chapter 20 of the Divine Pivot. When the pathogen is located in the stomach and spleen, a person will suffer from pain in the muscles and flesh. When the yang qi, the stomach, has a surplus and the yin qi spleen is insufficient, there will be a sensation of heat in the center and the person will be constantly hungry. One who suffers from stomach yin deficiency will experience constipation, dry mouth and throat, and thirst, but without a desire to drink. Small, irregular, or horizontal cracks in the center of the tongue, together with the pale red tongue body, reflects the onset of stomach yin and fluid deficiency. The crack can appear quite quickly as a result of improper eating habits, but once these habits are changed, the cracks will disappear. The cracks in red tongue often appear to be deeper than those in pale tongues because the yin deficiency is accompanied by the development of heat. A deficiency or lack of fluids will result in insufficient tongue coating, which will take on a peeled appearance or show an irregular distribution. If these types of coating appear specifically in the center of the tongue, it is a sure sign of stomach yin deficiency. To summarize, in the case of stomach yin deficiency, the tongue coating in the center of the tongue will be especially affected. It will be peeled, dry, or without root. In the case of kidney yin deficiency, a rootless, irregular-looking coating will be more widespread and will appear in a connection with the red tongue body. So we have here a case of a female 42 years old. Ang tongue niya is slightly pale, swollen edges, indicating spleen qi deficiency, accumulation of dampness. There is also a slightly reddish center without root, indicating that there is an onset of heat and dryness in the stomach. Meron din siyang white thin coating, which is normal, and meron siyang depression at the root. So this indicates that there is an essence deficiency. Sa symptoms, there is tendency to catch cold, severe exhaustion, desire for sweet foods, weight gain, loose stools. Sa Western diagnosis, there is none, and sa background to disease, overwork, caffeine abuse. Next case, we have a male, 26 years old. Tongue po niya is pale red, slightly swollen. Ibig sabihin, there is a slight spleen qi deficiency. Meron ding slightly peeled red center. Ibig sabihin, there is an onset of heat in the stomach. Next, meron siyang yellow coating with red points at the root. Okay, so there is a damp heat in the intestine. Sa symptoms, there is heartburn, regurgitation, stomach pain with stress, diarrhea after intake of dairy products. There is none sa Western diagnosis, and sa background to disease, stress due to examinations, excessive intake of dairy products. Next patient, we have a female, 51 years old. The tongue is pale red. Ibig sabihin there, it is normal. There is also a peeled red crack center, the stomach yin deficiency with heat in the stomach. Next, there is yellow greasy coating at the sides. Okay, so accumulation of damp heat in stomach and large intestine. There is also a reddish in the anterior third, meaning there is heat in the upper burner, especially in the heart. Ang symptoms, bleeding gums, mouth ulcers, there is dry stools, vaginal discharge, red face, lumbar pain. There is none sa Western diagnosis, and sa background to disease, physically overworked, late evening meals, and caffeine abuse. Sa case history, this 51-year-old Catholic nun worked for charity organization since the age of 20. The work in life in the cloister drained her. She tried to fight off continual fatigue by increasing her intake of coffee, and ate very late at night before continuing to work for several more hours. She often suffered from mouth ulcers and bleeding gums. She had daily bowel movements, but her stools were very dry. Her tongue showed a peeled red cracked center. Her pulse was slightly rapid and frail. Sa analysis, a tongue center without coating is a typical sign of stomach tion deficiency. Small cracks in this area point to a long-standing weakening of the fluids in the stomach. Late evening meals and chronic overwork are responsible for this deficiency. This and the excessive intake of coffee gave rise to stomach heat, which moved the tion blood vigorously into the stomach channel. Hence, the teeth and gums are situated along the yang brightness, the yang min channels of the stomach and large intestine. Injury to these channels by heat could well result in bleeding gums. Incessant mental and physical overwork, as well as heat in the stomach, agitates the heart. When the heat becomes excessive, it evolves into fire. This can injure the tongue, an offshoot of the heart, and cause the appearance of small, red, painful mouth ulcers. In this context, it is interesting to see how at the beginning the redness is found in the center of the tongue, then later spreads to the tip of the tongue. Heat in the yang brightness channels also involves the large intestine. This and the underlying stomach tion deficiency are responsible for the dry stools. Finally, a slightly rapid pulse reflects the presence of heat, and the frail pulse indicates qi deficiency from overwork. So another case, we have a male, 44 years old. Ang tongue po niya, pale red, slightly thin tongue body, edges slightly blue. So this indicates that there is a spleen deficiency, slight liver blood deficiency. There is also a vertical crack with the small horizontal cracks branching off without coating. So there is a stomach tion deficiency. Meron ding slightly red centered to the tongue. So there is heat in the stomach. Ang symptoms, there is a heartburn, stomach pain, hot feeling in the stomach, fatigue, inability to fall asleep. Sa Western diagnosis, there is a reflux esophagitis. Sa background to disease, irregular eating habits, strong demands at work. Next case, we have a female, 38 years old. The tongue is pale red, which is normal. Meron din pointed shape, which is a slight heat in the heart. There's also dry red center with small cracks. Okay? So ito po is heat in the stomach at the onset of stomach tion deficiency. Meron ding slightly contracted sides of the tongue. So meron siyang liver qi constraint. Ang symptoms, there is a bleeding gums, dry stools, pain under the ribs. Sa Western diagnosis, there is periodontitis. Sa background to disease, excessive consumption of spicy foods, caffeine, and black tea. Next patient. Okay. Sa case 5, feeling of pressure and pain under the ribs. Mrs. S had changed her diet according to the principles of the 5 elements. She diagnosed herself as suffering from spleen deficiency. So she self-prescribed a diet of hot, spicy foods. After 3 months of this diet, she suddenly experienced uncomfortable pressure under the ribs that was worst on the right side. The pain was occasionally quite strong, worsened at night, and sometimes woke her up in the early morning. From ovulation until the onset of menstruation, the intensity of this pain increased. During this time, she also suffered from painful distended breast. After meals, Mrs. S often experienced a heavy or full feeling in her abdomen. Her stools changed from being dry and pellet-like to being loose. Mrs. S worked 40 hours a week and studied at night. She often felt tired and overstretched from too many demands as well as emotionally imbalanced. Over the past 12 months, the dentist diagnosed the onset of periodontitis. The tongue body color was normal, but the center of the tongue was red, dry, and slightly cracked. Her pulse was thin and slightly wiry. Sa analysis, the daily consumption of hot and spicy food gave rise to heat in the stomach. This was reflected in the red, dry center of the tongue. Because of the demands at work and her constant tiredness during the day, the patient consumed a lot of black tea and coffee, thus contributing to the heat and leading to a slight deficiency fluids in the stomach. This case of early-stage stomach deficiency manifested in the tongue as small cracks in its center. The stomach deficiency plus the heat in the stomach were likely responsible for the inflamed gums. The different demands in her life led to a liver qi constraint. The uneven flow of liver qi manifested as pain and sensation of pressure under the ribs, as well as increased pain during her menstrual cycle. The changing stools, painful breast, and wiry pulse were also signs of liver qi constraint. The upward and downward directed actions of the stomach qi were also impaired by the constrained liver qi, as reflected in the sensation of epigastric fullness after meals. Pain under the ribs that worsen at night may be due to the constraint of qi, which often gets worse when one is passive and improves with movement. So sa treatment, the goals of treatment were to spread the liver qi, clear the heat from the stomach, and nourish the stomach yin. Mrs. S changed her diet. She started to eat fruit, especially pears, and abstain from spicy foods. The patient was also treated for 6 months with acupuncture and Chinese herbs. The following set of points was gamit siya ng PC6, and MIDLINE technique is neutral, liver 3 neutral, GB41 draining, TB6 draining, stomach 44 draining, stomach 34 draining, stomach 36 tonification, and spleen 3 tonification. This treatment was supported with Chinese herbs. Over a period of 3 months, the patient took a decoction of minor blue pleurum, decoction, xiao, chai, to hutang. Her symptoms improved considerably and she seldom experienced pain. However, the demands of work and emotional problems still had a tendency to trigger the pains under her ribs. The tongue resumed its normal shape. The center of the tongue was no longer red, and the depth of the crack slowly diminished. This reflected the regeneration of fluids and yin in the stomach. In addition, the pus lost its wiry quality. Thank you for your attention.